to really dive into the meat of this and really talk about how all roads lead to one destination. So what does that mean? Well, the goals, everything that we do, from how we start our education, from the medications that we choose to the referrals, they all lead to one or a couple of goals. And those goal treatments are to prevent and delay complications and to optimize our quality of care. That is part of the standards. That's standard 4. That is what we do. It's not just to get the person to less than 7%. That may not be the best way to optimize that patient's quality of care. And we'll talk about that a little bit later. But how do you go about preventing and delaying complications and optimizing the quality of care? It's putting the patient at the center of your care. First things first, we need to understand what their preferences are. What are their personal goals? You know, I had a patient the other day that she was having some issues with her diagnosis. And, you know, first I asked permission and told her, if you don't feel comfortable answering this question, I'm okay with that. But is losing weight one of your goals? And she told me flat out, I know that I need to lose weight, but I'm actually okay with my weight right now. I'm more concerned about my blood sugars dropping. Well, that's where you center your education, because that is what is priority on your patient's mind right there. It's not that we're not going to talk about and address, you know, losing weight, but our patient has told us what's important to them at this point. Like, she's nervous about that. She's concerned about that. So that's how we go about prioritizing our care. We're also taking in consideration the patient's cognitive abilities. The care for someone who has dementia is totally different from somebody who does not. You know, thinking about our different populations, a person that has type 1 is different from a person from type 2. A person who's 30, it's different from a person that's 60. You know, you really have to think about the person and their cultural factors. And something that I think I tend to see a lot of people overlooking is literacy and numeracy and health literacy. I think we can prejudge people and think that because they come into our office and they're well put together and they speak well for themselves, we automatically assume that they understand what we're saying in our terms that we say it in. There are many people out there that are highly successful people, but by definition, they are considered illiterate. And so we have to ask the questions to bring that out, not to shame them or make them feel, you know, ashamed of that, because people do feel ashamed by that, but asking them, how do you prefer to learn? It may be written, it may be on-demand learning, and you tailor your education for your population or for the individual.